Just want to see if I can help you think about the causes of elbow pain. Elbow pain. I think of the regions of the body, this is probably one of the easier ones. There aren't so many diagnoses to consider. I think if we divide the elbow into anatomical regions, it helps. So, when your patient tells you they've got elbow pain, get them to point to where they feel it. More often than not, it's lateral. But sometimes it's medial. And then again, occasionally, it's posterior. And if it's not any of those, it might be anterior. So what kind of diagnoses have we got in each of these regions? Within lateral, which I indicated was the most common, it's usually tennis elbow, sometimes known as extensor tendinopathy or lateral epicondylitis. If it's not that, it's a little trickier. We might have a nerve entrapment. And apparently a branch of the radial nerve can get trapped in this region, causing pain on the lateral side, and that branch is called the posterior interosseous nerve. Particularly in younger people, where there's compression through sporting pursuits like throwing, there may be damage or lack of satisfactory development of the bone from the more primitive cartilage. And we might call this osteochondritis dissecans. And when it occurs in the capitellum or the radius, we might get lateral elbow pain. The radiohumeral joint, which allows supination and pronation, is a synovial joint, and so it may be inflamed in conditions like rheumatoid arthritis, and we might have radiohumeral synovitis. But in my practice, this is rare. There is a bursa in relation to this radiohumeral joint, and this may become painful. So we have radiohumeral bursitis. But remember, lateral elbow pain is common, and the common cause of lateral elbow pain is tennis elbow, lateral epicondylitis or extensor tendinopathy. Let us move on to medial, which seems to be the second most common region of elbow pain. And the equivalent to our tennis elbow is golfer's elbow, or flexor pronator tendinopathy. But in the sporting population, we may also see a medial or ulnar collateral ligament sprain, a chronic sprain occurring again in throwers. So we're beginning to see a picture of throwing injury, overuse throwing injury, that involves a medial collateral ligament sprain, and on the lateral side the chondral defect due to compression. As with lateral elbow pain, there may be a nerve entrapment. The ulnar nerve runs behind the medial epicondyle, and though it may give symptoms distally in the hand of numbness and pins and needles in the minor two fingers, it may cause discomfort itself around the elbow. So I'll include ulnar entrapment in my list of medial elbow problems. And now, very rarely, there may be a problem of avulsion or apophysitis around the medial epicondyle. Lateral is common, and the common cause is extensor tendinopathy. Medial occasionally occurs and is usually the golfer's elbow or flexor pronator tendinopathy. But let's move to posterior, which we see occasionally. Now, the most striking feature that we see in the posterior elbow is swelling, the egg-like swelling of olecranon bursitis, which in my experience is usually not painful unless it's related to trauma, for example, a goalkeeper recurrently diving and traumatising the posterior elbow. Sometimes the pain is related to forced extension, which may occur in some pursuits, such as sporting pursuits again, throwing for example. And osteophytes might have built up in the posterior elbow, in the olecranon or the olecranon fossa, and these impinge on forced extension. So we have the syndrome, if you like, of posterior impingement and its causes. As with any insertion of a tendon, it may become tendinopathic and produce pain, and occasionally we'll see triceps, posterior muscle, tendinopathy near to the elbow at its insertion. Anterior does seem to be very rare, but occasionally I've made a diagnosis of bicipital insertion tendinopathy. And then we mustn't forget causes outside the elbow giving rise to referred pain. So cervical nerves, perhaps from a brachial plexus, just general nerve tension itself. And I suppose occasionally compression from a tumour at the apex of the lung, as a Pancoast tumour. These will give rise to pain in the various regions of the elbow according to which nerve is being affected, so I'll place that in the middle. With this differential diagnosis for elbow pain narrowed down to just a few in each region, we could proceed to an examination to get a better feel for which is the diagnosis.